We so desperately want our loved one to change. That we don't want them to be drinking anymore. We don't want them to, use heroin. We want them to live their life. And then we don't let them live their life because we're still treating them the same way when they were active in addiction.
Welcome to Positive Recovery MD. If you're listening, chances are you want to create happiness around you and thrive in your life. We're glad you're here and you've come to the right place. This podcast will inspire and motivate you to not merely survive your recovery journey. We'll give you the tools to build or strengthen your foundation to thrive and flourish in your life. In each episode, we will come together as a community to have authentic conversations around addiction, recovery, and what matters, growth and progress, not perfection, all while developing positive habits for you to utilize. To learn more, please visit positiverecovery.com/podcasts to sign up and to receive the daily positive interventions that we'll review, as well as gain access to exclusive Positive Recovery content available only to Positive Recovery MD listeners. All right, let's get started.
Hi, Positive Recovery MD listeners. It's Colleen Hargrove, and I am Julie DeNofa, and we are here today on a podcast takeover. We're taking over the podcast from Dr. Jason Powers, and Colleen and I are ready to have so much fun. Colleen, what's your thoughts about a podcast takeover?
I love it. This is one of the best things that we get to do as Positive Recovery employees. And I just think it's fun when we get to step in and take over for Doc.
So for our listeners, Colleen and I are going to focus today on the family. But before we do, just a little bit about myself. My name is Julie. I am the president of Positive Recovery Centers, and I have worked in the addiction space since 1990. Started out as a behavioral health tech, working on a psychiatric unit, on an adolescent unit. And talk about family work. Boy, we did a lot of it for sure. Sometimes I didn't know if I was treating the adolescent or their parents. And I started my career out as a nurse. I was blessed to work with so many wonderful people that became my mentors. And I have a love of learning, and I'm always curious, asking so many questions. And I quickly got into the clinical side of things, then the improvement process side of things, compliance, and then wound up in the business side of things. And George Joseph, our founder and CEO, was just so generous with sharing his knowledge with me and afforded me the opportunity to be where I am today. So for that, I am grateful. And Positive Recovery Centers is like family to me. So as we talk today about families, I keep that in mind too, that all of the people that we work with have become part of my chosen family. So Colleen, a little bit about you.
My name is Colleen Hargrove. I'm a licensed chemical dependency counselor in Texas. I have a master's of science in addiction counseling, and I've been working in the field since 2011. And in 2012, I started working with Julie and Dr. Powers. So I have spent the last almost 13 years as part of the Positive Recovery family. And I'm truly grateful to be a part of this family. I'm truly grateful to have been able to raise my children as a part of this family. And I'm just really excited to get to talk to you guys. I am a recovering person myself, and I did grow up in an alcoholic family. So the family dynamic thing is something that really, hits home with me a lot. It's something that I love to do. I love working with families that are in recovery and just starting on this journey.
So we sometimes see families, when they are desperately trying to get someone into treatment, and that might come through our admissions department. It can also just come through people who know that we work in this space, and they reach out for help. And for me, when someone reaches out to me, I feel like it's an honor to be able to help someone walk through getting a loved one help, and just being able to guide them, because the healing process that starts on someone's recovery journey is not just with the person who's suffering from the addiction. It's also the entire family that's been brought into it. And so what I want to do is just share that, like, a lot of our listeners have sent us questions, and lately they've been revolving around kind of the family piece. And so we wanted to take an opportunity. So we're kind of lucky, Colleen. We've got our questions mapped out for us based upon questions that our listeners have already asked. So let's start with the first question that we got was, how does addiction impact family dynamics and why is it often described as a family disease? So you want to take a stab at that?
Sure. So it's interesting because, we can have like three different families that are all dealing with addiction and the dynamic is similar. However, like the rules change around. And so, like, some of the different dynamics that we see with families is, sometimes we work with clients where the families have completely like cut them off. They're done with them. Maybe they've been doing this for years and they're really, really tired. Oftentimes we can deal with families that have, I hate to use the term failure to launch, but an adult child that they've been taking care of for 20 years past their 18th birthday, and the families are doing everything for them, and the client is doesn't have any self-efficacy ability. The other one that I see a lot, especially in outpatient treatment, is I treat a lot of parents who have younger children. And so, what that dynamic looks like is just a lot of fear in the house, a lot of uncertainty for the people living in the house. And I think addiction is like, when you think about a family that has a person in the family that's diagnosed with like MS or cancer or anything like that, the family is really just in survival mode, right? Like, we have the patient and all of the side effects and the treatment attempts and all the energy that takes out of the family, and everybody just kind of adjusts to a new way of life just to keep the status quo. And so it's the same thing for addiction. It comes into a family and it just kind of rolls everybody around until everybody kind of finds their spot.
Yeah. What do you think when people talk about, kind of didn't cause it, can't cure it, can't control it? Like, where does your head go for that?
That's that's an Al-Anon statement, and it's a perfect statement, right? Because a lot of times people think if they can just control their loved one's use or they can just control their behavior, that everything's going to be okay. And I can tell you from personal experience, it's not. You can take cell phones away from kids and you can take their checking card away, but like, kids are going to find a way if they want to find a way. And the same thing with adults. I hear stories about people taking car keys and credit cards, and even one lady took her husband's shoes so he wouldn't go out and walk to buy the alcohol, and he tells the story about walking there barefoot. And so that's the whole control part of it. And you know I just, you can't cure it either, and that's the other big one, right? Like, and that's where the control comes from. If I can just control it, then I can figure out a way for it to go away, and it doesn't work like that.
So I can speak honestly and somewhat vulnerably about the fact that while I have never had my own substance use disorder addiction, I have certainly been part of a family system where my significant other was an alcoholic. And there were times when I thought, well, if I just do this, or if I can make him happy in this way, then it'll get better, and then I oftentimes made it about myself. Right. And I was really unhealthy in that relationship at that time in my life because I just was trying to fix it all the time. And I can remember a time, and I worked in this space, right? Like, I could give beautiful suggestions and recommendations and work through the reconciliation process with other families. I like reuniting families who hadn't talked to their loved ones in 5 years, 10 years, whatever it was, and work through the process with others, but I couldn't do it in my own household. I remember a time at like 3 a.m. in the morning driving to the bail bondsman to bail him out. And the while I'm thinking, gosh, this is just nuts. Like, why am I doing this? He should sit there, right? I am, a president of a drug and alcohol treatment center, and I'm driving at 3 a.m. And I was really embarrassed at the time. I probably wanted to cover for him at various points. And I always thought that if I just was enough, that he might stop, right? Or if I did something better with it, that he might stop. And so I totally took all the unhealthy pieces of that on. And so often when I'm talking to families now, I can certainly come from a different perspective because of my experience. But lots of times family members are saying, like, I don't understand. If he loved me, he would stop drinking, or if she loved me, or if she cared about her kids at all, she wouldn't do this. Or, I've done everything. And the truth is that when the families are reaching out to us, and for our listeners, if you have a family member that needs help, you probably have done everything that you could that was healthy, and you may now be in an unhealthy territory. And so what I like to tell people is to get involved in the recovery community as a family member, whether that Colleen already made reference to Al-Anon, but there's all kinds of support programs for families that I think is really important. And it is a family disease. You have to kind of renegotiate where your boundaries are and be able to do that and take care of yourself while still instilling hope, in the person who's suffering from the addiction. And that can get tricky sometimes. What say you, Colleen?
Well, I love what you said, because I think, one of the things that I hear a lot is, if he loved me, if she loved me. And I love how you said that, because I was just thinking I was going to point that out too. And I think, being involved also, and I hope I'm not jumping ahead, but like being involved as a family member in the recovery process. A lot of times I'll get moms or dads in treatment, and I'll meet with the husband or the wife, and then there's children, and I'm like, we need to bring the kids in. Like, they've seen the destruction of the addiction. We need to allow them to see the healing, and there's things that we can educate even children about, right? Like at an age appropriate level, about what addiction looks like and what recovery looks like. And they have feelings, thank you for being vulnerable, Julie. I've lived through a similar situation, and it's weird, because even as a clinician and a person in long-term recovery, some of the stuff that comes out of my mouth, or would come out of my mouth, I was like, where did that come from? Because I can be so loving with clients, but when it's close to home, it's a little harder, right? Because you're the one on the end going, well, wait a minute, you know, I should be able to fix this. Like, I know all these things, and it just doesn't work that way. It doesn't matter who you are. You can't fix it for somebody else.
Right. It brings up, a lot of times you hear people using the word, and I used it myself, like about codependency. And it's a term that like really gets a bad rap. You're like, it really does, because it's viewed as a negative concept, right? And I think that we need to learn how to love people through their addiction, right? Loving them through their addiction while taking care of yourself. And I think that's really hard to do, because people lose sight of where I end and the other person starts. And it gets to a place where boundaries are really hard to establish. And I think that that's where families can benefit the most in terms of education. And that is another question that we have, that a listener sent in, was how can families educate themselves about addiction and recovery to better support their loved ones? And so really there's a lot out there on, education here. I'm located in Houston. Colleen is in the Austin region. Here in Houston, we have a lot of really wonderful programs that are out there for families. I can think of a couple that the Houston Council on Recovery offers for education. We ourselves at Positive Recovery Centers have a family support group that is run by a almost infamous Chris Davis, who's an LCDC, who's been doing this for a really long time, helping and supporting families for, more than 25 years. And so that's something that we offer that is, free to anyone who is wanting to learn more about addiction and how to help their loved ones. There's lots of books that are out there about it. There's amazing interventionists that families can work with when they need additional support. More than anything, I think first it's taking the time to educate yourself on what you would like to see different in your life and what you're willing to tolerate and not willing to tolerate. And it kind of gets into the family letter type of situation, in the direction that I'm going with the conversation. But it's questions that we have to ask people is, what are you willing to tolerate? And I think when you really get down to it, when folks are looking for treatment for their loved one, they're getting close to the end of being able to tolerate much more. All kinds of things happen with our loved ones when they're active in their addiction, and the impact that it has on the lives of the entire family. So from an educational standpoint, Colleen, what are your recommendations?
I think first and foremost get educated, right? Like, as part of our family program, we do show a video that Dr. Powers created, and it's amazing, like the reaction I get from parents that see that video. A lot of times it's parents that have been through this over and over again with their kid, and they've never been educated about the disease, or maybe they just didn't hear it the previous times that they were attempts to educate them. But one of the things I tell family is, the difference between enabling and supporting is this. It's enabling if it's feeding its addiction or their addiction. It's supporting if it's feeding their recovery. And so, like, that's a real simple way for me to explain it. It's one thing to pay your person's rent when they're still active in their addiction. It's another thing to pay for sober living if you have the means to help them, and just really identifying the differences in, what recovery and what active addiction mean.
Yeah, I think it's tough. I think back to a phone call that I just had not too long ago with a family member who was saying, like, I don't think that you're hearing me. I've already been to the family education for 3 other treatment centers. I've already learned all that I can learn. I don't want to attend family. And, the thing is, I get that. I get it, right? Like, cause you've done so much. My ask is always that there's just a willingness, just leave the door slightly open, because our approach at Positive Recovery Centers is somewhat different. And the educational component of it isn't looking to just fix things. It's looking to look at the root cause problem. And really, it does take a look at what our part in it. And when I say our part, I'm referring to myself as the family member here. What is our part and what can we do differently? And getting that piece is very freeing, right?
Yeah.
Because oftentimes the family members are like, I don't understand how this happened. She grew up in a family that, we gave her everything and we did everything for her. And sometimes that's the problem, right? Like, it's not the other way around. But at the same time, this is such a topic that we could just go on and on about, no doubt. But I will say is that for me, it's such a vital part of treatment, because when we focus only on the person who suffers from the addiction and they're really kind of digging in and working hard and learning and spending time, like really kind of living their life differently, if they get home to a situation that hasn't changed at all, then things start repeating themselves. We so desperately want our loved one to change the way they were, right? Like, we don't want them to be drinking anymore. We don't want them to, use heroin. We want them to live their life. And then we don't let them live their life because we're still treating them the same way when they were active in addiction. And so it takes that fine, kind of balancing. It's like a balancing act for sure. And when only the person using is treated and not the family, I don't have a statistic. I know there's probably people out there that do, but the outcomes cannot be as good as they are when the family is involved. And when there's no immediate family, there's still someone in that person's life that we can pull in, that can be a support, that can serve as that family of choice, if you will. It may not be appropriate, or it may not be okay for the wife or the husband of someone that was really in a toxic relationship to say, like, no, you have to do family group, right? Maybe it's not. Maybe there's too much hurt. Maybe there's too much pain that's there, that has to be worked on first before it can be brought together. And when you are working with a professional team, you can get to that place to see what's right, not only for the client, but for the family member as well.
I also want to kind of throw in there, a lot of times when families are asking what they can do, one of the things that I see families struggle with the most is to support the clinician's recommendations. And so what'll happen is they'll bring us their client or their loved one to treat, and we'll work with them for 30 days and we'll put together this beautiful discharge plan. And, all of a sudden the client's like, well, I just want to go home. And then the family co-signs on that. Right. And so it's like, it's like with any other disease, if somebody lays out the best form of treatment, you would follow it. And we don't see that often in our field, not as often as I would like. And I get it. Like families feel bad, they feel sorry for sometimes the addicts holding their family hostage emotionally. I've seen that happen a lot. If you don't do this, I'm not going to do this, or I am going to do this. And so, and fear is a great bargaining tool for somebody who's in active addiction. And so, really, like, I think just working together with the professionals, getting that education, understanding what a solid course of treatment looks like, and then being able to encourage their loved one, to follow through with it. And sometimes it does take a little bit of a nudge, right? Like if I'm an addict, which I am, but if I'm in active addiction and like my parents or my husband takes me to treatment and then I call them 4 days and want to come home and they're like, okay, like I'm not gonna stay and be uncomfortable and do the work that I need to do. And so again, I think that's like learning the limits and setting those boundaries between what is enabling and what is supporting.
Yeah, and that happens. It happens in all levels of care, of treatment, and even when people are not in treatment. Often will hear family members say, well, I don't really know what to do. I feel like I'm walking on eggshells. I feel like if I don't do what they say or what they ask, then if something bad happens to them, then I will feel at fault.
Mhm.
And so, when I hear that, it really hits my heart, because it's a really, it's like that tough love situation, right? When do you employ that? And when do you get past kind of that space of that this is going to be my fault? And I think you just have to come to the realization that you cannot control it.
I was just going to say that.
Right. And that's it. And that's so hard because we get caught up in that. And our clients are like our clients, folks who are in treatment are often really great at knowing exactly what buttons to push, what words to use to kind of like get in there and kind of rock the boat with their family or with their loved ones. And, one time, this is years ago, I had a patient that called their wife and wanted to get picked up, and it was somebody that needed to be in treatment, like desperately needed to be in treatment. Like there was all kind of medical complications, there was some co-occurring mental health issues, and just could not stop drinking to save his life. The family member called and said, you know I got to come pick him up. I got to come pick him up because he's so unhappy there. He said, like, the food is terrible and the wallpaper is peeling off the walls. And it's just an awful situation. And we're just going to I'm going to have to come get him. He's going to come home for like a week, and then we'll find someplace else for him to go. And I said, do you mind if I pause you for just a second? I'm concerned because we don't even have wallpaper here. Right. And so this guy was like complaining about everything and anything. Obviously, we checked to make sure he was okay and that he wasn't delusional or seeing things that weren't really there. But it really was just to pull on the heartstrings. And so, he knew his wife wanted him to be in kind of a creme de la creme treatment center, and we had no wallpaper. So it couldn't have been happening. The food was good, and it was just one of those situations where it was, I'm going to pull out all the stops to figure out a way to get my wife to come pick me up. And so we had a really good talk about that piece, and she wound up not coming to pick him up. And this is someone that is still sober today. And this story goes back, gosh, I'm terrible with dates, but it's probably 11, 12 years ago that this happened. So, I love the opportunity to work with families and to be able to kind of guide them, either through the process of kind of not co-signing off on stuff, or helping the reconciliation process, and being able to set a firm boundary or limit and still do it in a loving way. Because that is possible. People say, I don't want to be mean. I don't want them to think I don't care about them. I think in my own personal story, had I set limits a whole lot sooner,
Mhm.
my person probably would have got sober a whole lot sooner, right? Because I was not loving him through the addiction. I was loving him to death.
Yeah, I agree. And I think that when we do have a loved one that's going through addiction and we don't hold boundaries, we just get frustrated. They're not taking anything serious. It's up to us to set those boundaries. And those boundaries really, we set them to keep us healthy, right? Like I have a lot of women friends in Al-Anon, and like they amaze me because like they have this whole love and support but detached thing. Like I like it's amazing to me the way that they are able to walk through their loved one's addiction. And so, I think about that often. And what it really is they set boundaries. They set boundaries to make sure that they are taken care of. And as long as they're taken care of, then they're okay with the rest of it. They leave it, to be worked out with their loved one's counselor or treatment provider. And they just keep plugging away. And again, I think that speaks back to the like difference between, supporting someone versus enabling someone.
Yeah. So just to kind of recap, and thank you to our listeners for these great questions. I hope that you've enjoyed listening to them. But as a recap, Colleen, someone calls you up and says, oh my gosh, my husband is really struggling. He can't stop drinking. He's talked about wanting to get help. He's now says he's willing. He just wants outpatient treatment, but I really think he needs detox. What would your recommendations be to that person?
My recommendation would be to go ahead and schedule an appointment for him to come in and do an assessment so we can assess the level of care that the client needs. I also find that it's a lot easier to get a client to the level of care that they need when I can meet with them one-on-one versus playing, go between them and their wife. And so oftentimes when we get clients in front of us and they start recalling like all of the information, they're able to see that they really may need to go to detox, and residential doesn't sound like such a bad idea.
So how do I support without enabling?
So my standby answer is support recovery, enable addiction. And so as long as I am supporting my loved one in their attempts and efforts to get sober and get better, then I keep doing that. And if I'm going to enable them, then I need to really step back and set some boundaries. And really the question you want to ask is, am I taking care of myself? Is my life out of control because of alcohol?
Another pause and moment. So, I feel like that I have to take a breath because this is such a big topic. And I think that there's so much here that we could go on. And I want any family member who's out there to know that there is help. There's always help available, whether that's through support groups, whether that's through, a counselor or a therapist for yourself. You can start there. If your loved one is not interested in getting help initially, you can be interested in getting yourself help, or you can be interested in getting yourself well, and being able to be aware enough to know that you probably do need some help. So with that, what I would like to say is that you can find us on social and LinkedIn, and the links will be in the description. We'd love for you to come hang out with us and check us out on our social media. If you have any direct questions and our admissions team can support you or guide you, please do so at 877-4-SOBRIETY or 877-476-2743. And I want to end just like Dr. Powers does. And what his little thing is to, and we've really kind of covered this throughout our podcast, and I have had fun taking over. I hope we do him justice.
All right.
So for our listeners, take care of yourself and take care of others. Colleen, thanks so much for doing this with me.
You're welcome, Julie. Thanks for having me.
Thank you for listening to this episode of Positive Recovery MD. Don't forget to visit positiverecovery.com/podcast to sign up to get your daily positive interventions sent straight to your inbox. Be sure to subscribe to Positive Recovery MD on Apple Podcasts or wherever you listen to your podcasts to receive an automatic download when a new episode drops. And as always, if you or someone you know needs help, visit positiverecovery.com or call 877-4-SOBRIETY. That's 877-476-2743. Our why is simple. We care. We are here to help.